Guys, if y'all ready, we'll get started. In the event of an emergency evacuation, an alarm will sound. Everyone should exit the building by way of the nearest stairwell in a safe and effective manner. If the nearest stairwell is blocked by smoke, please use the other stairwell. Do not use the elevators. Once you have reached the main floor, follow the exit signs to exit the building. Quickly proceed away from the building. Please be mindful of others evacuating and of emergency vehicles. We do have a quorum, ma'am?
Yes, you do.
Items on the agenda. Is there anyone wish to speak to items on the agenda? All of you sitting up here, if you wish to speak, all you have to do is hit your button and it will immediately light up. Seeing none, stand for a motion to approve the minutes of April 30th. Any changes or alterations? All those in favor, please say aye. Aye. Opposed, say nay. Now, the only thing we really have tonight, guys, is the approval of the contract with Blount Memorial Hospital for the Employee Health Clinic, formerly East Tennessee Medical Group. However, they are continuing it exactly the same with no changes in funds required. So I'll stand for a motion to forward that to the full commission.
So moved, Mr. Chairman.
All right. Second. Okay. Mr. Dunlap, your light is lit.
Thank you. Has anyone seen any difference in the clinic since this thing changed over last year? Has any of your employees made any comments on the wait time, type of service? Has anybody heard anything?
I will answer for mine if you'd like for me to answer for my employees.
I want to hear.
Recently, my employees in the last 6 months said things have improved. You know, some of them did complain originally, but they say it has improved. So I've not heard any complaints from my employees.
Okay, that's what I've seen also, Gary. I myself have been over there a couple of times, and then a major difference. So I just want to get that out before we even get voted. Okay.
Okay, Miss Chris.
Same here. I'm hearing things are improving. There's some glitches every once in a while, but you can never tell what your busy day is going to be, and that's, you know, so it has improved.
Thank you. Anyone else? Seeing none, all those in favor, please signify by saying aye. Aye. Opposed, say nay. I heard no nays, so we'll say it's unanimous. Overview of upcoming open enrollment. Mr. Stagans.
I just want to give you all an overview of the enrollment coming up. We've had Jody, myself, and Lindsay, and Drew and his staff had a couple meetings trying to see what we're going to do this year. You know, last year we just did a phone enrollment, and there wasn't any one-on-ones. With the changes in our plan this year and the fact that we didn't have any one-on-ones last year, what we're looking at is starting out earlier this year, around September 15th, and having large meetings with each one of the employee groups at their facilities. The HR staff will conduct those meetings. Before the meeting, we're going to get in the hands of the department heads and the supervisors a list of benefits for each employee to have, to be looking at, to see what they have and what coverage they have. On there will also be where they could check a box to where they want to leave it the same, or they'd like to talk to an enroller on the phone, or if they'd like a one-on-one face-to-face meeting. We would ask that those would be submitted by October 15th, that all those be brought in. We're kind of doing a little shift this year, and I'll talk to David a little bit about it because I think it really affects the schools. Instead of us following up on 2,000-something employees, we're going to ask the department heads and the supervisors to ensure their employees have turned everything in and then get that to us. I think that's a more streamlined, y'all know your folks. You probably already know who's going to need a little more help than others, and that way we'll kind of streamline it and make sure that we get paperwork from everybody. The other form is going to be the form for the spousal surcharge that we'll have everybody fill out. They will have that there at the time that we do our group meeting. October 15th and November 15th, that's when Drew and his staff and Humana will process everything and make sure all the changes are done that need to be done. They've been elected. And then kind of something we're going to follow up between November 15th and December 15th. Because of the systems that we have are so antiquated, it's hard for us to pull another list of benefits. What we'd like to be able to do is to get another list of what each employee has to each employee for them to review again to make sure there's no errors, make sure it's what everybody had elected. That's a little difficult. So we're sort of working on how we're going to complete that last part, but in some way, whether it's an exception report where we reach out just to those who made changes that might have not looked like it made sense to us to make sure that that's what they wanted to do, or just a full-blown report. We're not really sure at this point. That's kind of what we're working through and we talked about today. But that way we should wrap up open enrollment by December 15th, and hopefully, last year we had some confusion on the flex spending plan. I know there were a few folks that didn't realize they had to re-up every year, and were kind of disappointed when they didn't have that opportunity. So that's what we're trying to avoid is people who changes being made that they didn't want, or changes they wanted didn't get made. Any questions? And we're still working through that, but I think we've got a pretty solid plan right now.
The news cycle takes place.
It does. We're going to shoot for December 15th. That gives us a little bit of room there.
Okay, ladies and gentlemen, anything else? We will schedule a meeting for the first week of September. There is a policy issue that has been brought up by Mr. Stallions that we will meet and discuss then, and we will finalize the preparations for early enrollment, as it will start on September the 16th. So we will have a meeting in September. Right now, it will probably either be the 3rd or the 5th. So let you know that in advance. And there is one issue that Mr. Stallions is wanting us to confirm and finalize and get set up in place before open enrollment. So that will be when we will look at it, and we'll get everything else ready for open enrollment. Is that good with everyone? Ladies and gentlemen, I'll stand for a motion. I'm sorry.
May I just have one question, and I've been hit by this, and it also affects my wife and me, is when spouses work for the same employer, like my wife and I work for Blount County Schools. I know we have the same with the general county. How are we going to do that? Because we could obviously my wife could do employee only, I could do employee and children, or I could do family. The deductible's different either way. I don't really know what the best way to approach that is, or how we're going to do that, or how Jody's going to, or Dawn are going to approach that when we get there.
That's what we will be setting up at the September meeting, Mr. Merle. That's what has been brought up by Mr. Stallions.
Okay.
And since we didn't have it on the agenda tonight, probably best served for us to put it out, let everyone look at it, try to get the influx of the department heads, because with the new system as it's set up, where everyone in essence is paying, that's what we need to get set up, Mr. Merle. So
okay,
that's
I just want to bring it. I wasn't sure if that's what you were referring to, but
Yes,
Don and I
sir.
had that conversation. I think it's about 20 couples for our system. I don't know what general county is. So I've gotten it from several people. So if we can iron that out, that's fine. Thanks.
And that's we will do that then, Mr. Merle. Is that good with you? Is that good with you? Got anything, Mayor?
That's good.
If everybody's good to go, we'll call this meeting adjourned. Have a great day. Thank you for being here.